I am Dr. NK Venkataramana, neurosurgeon, Brains Super Speciality Hospital. Spine development is a very complex because it is a series of bony structures hosting the spinal cord. Many a times during the development, a lot of defects can happen. Defects can be in the main bone itself, it is called vertebral defects, and there is a spinal cord which covers around the spinal cord. It is called as a laminae and the spinous process, and if they do not form properly, it is called spina bifida. Normally the spine closes itself into a one spine. If it is split into two, it is called bifid, that means it is a split one. So that has a risk of the spinal cord getting exposed to the external environment. Sometimes the spinal cord itself can get prolapsed, it is called myelomeningocele. Otherwise only the membranes covering the spinal cord can come out, that is called meningocele, or a variety of defects can happen. Now whenever you see a tuft of hair on the back, or a swelling on the back, an abnormal dimple on the back, or a fatty swelling, that indicates, that means there is a defect in the spine due to the development from the birth itself, and the spinal cord or some of the nerves are trying to come out of the spinal canal. So this can be identified very simply. As soon as the child is born, we should examine all the way from head to bottom to see that midline in the center of the spine, if there is any nevus, dimple, an abnormal hair, abnormal growth, sometimes a tail like structure, or any kind of an appendage. If you find such a structure, it is better to do an MRI scan, so that we know the exact underlying bony defect and the defect in the spinal cord. Earlier we correct this is better, so that the ongoing prolonged neurological damage can be stopped, and majority of the times these defects can be corrected unless there is a severe developmental problem with the spinal cord itself, and if we correct them, the children can recover and grow normally, and then can lead a normal life.